Okay, great. So we've had 3 very interesting talks from different dimensions into dementia and approaches to understand and to treat dementia. But we have an opportunity now for you to ask our panel anything that you'd like to.
So the way how the neuromodulation fundamentally works is there's various circuitry in the central nervous system that sometimes start changing or altering the function. So what we can do is essentially go to parts or components of the circuitry, and by activating different parts of the circuitry, by activating neurons themselves, enable that circuitry which is misbehaving to start behaving as we want it to behave or how it should have been behaving. And also this one component. The other component is in neuromodulation, when you do this repetitive type of treatment, in some diseases, sometimes some pathologies, you can essentially enable the circuitry to relearn new behavior or new patterns of behaving and restore some of the function back. I hope that answers the question.
Hi, thank you for the interesting talks. I'm interested in the care angle. So I have just a quick request and then a question. The request is for the exact reference to the gerontologist issue that you mentioned. And the question is about the gait study, the walking and the predictor of falls. I'm wondering how generalizable that might be, and whether actually this is something that, now that we know it's there, the wobble thing, is that visible to a caregiver? And could that become part of training for PSWs or staff so that we don't always have to install technology, and run computers to know about this?
I think that you're absolutely right, that these changes are, although subtle, are not invisible. People look visibly unsteady. One of the reasons I came to do this work was that I work in long-term care facilities. I consult there, and I see outpatients. And so people would come to my office, and one month they'd be walking, and a few months later they'd be in a wheelchair, and I'd say, what on earth happened? And people couldn't always explain. They said, well, they just weren't walking very well. They went, we just thought it was part of the illness, and that's that, And then when you delve down, there was a reason why that they became more unsteady and they ended up in the wheelchair. And so I think you're right. There's definitely an opportunity to help work with caregivers to get better at identifying factors that are contributing to people's mobility decline and how we can do better at preventing that. Part of the aim of this research is trying to understand the ways in which people's walking changes in dementia, so having a broader, so it's not always about just having the technology, and using the technology as a way to also evaluate some of the interventions that we want to do. So say we implement a walking intervention or an exercise intervention, can we actually quantify the improvement that people have? You can look at someone and say, yeah, I think they're walking better, but actually to say that, they're walking, 30% better has more impact in terms of justifying an intervention. And so that's another rationale for coming up with the technology. But I agree, technology is somewhat limited in that it can be difficult to implement it. And that's another reason why we designed this system around a video camera. It's meant to be, you could use this with like a surveillance camera. It doesn't have to be a fancy equipment. It's really just about using any video to be able to tell us something about someone's walking.
Yeah, that'll be quick. So it's the February 2018 issue of the Gerontologist.
Walter.
Well, thank you. Keith asked me a question. We're arranging for Keith to come down. And he asked me a question of how is artificial intelligence used in Alzheimer's and dementia research was the question. And I'm involved in philanthropy in a broad range of medical research in brain, heart, and in arthritis. And it's the same way all over with what's happening in medical research, which is a game changer. It's going to make developments in medical research expanded by about 1,000%. And I think within 20 years there's going to be not cures, but they're going to alleviate cancer and make it look like a cold. Treating a cold is going to be treating cancer. And the game changer that's occurred, which is amazing to me, is artificial intelligence and the use of that in medical research. Artificial intelligence is really three things. It's a combination of taking logarithms, getting data people, combining them with a lot of data, and then putting it up in the cloud. It's changed medical research through and through. And what I'd like to ask a question of here is the overall broad use of artificial intelligence in research for dementia, how it's going to change the game here and how it's being used in Canada. And Keith, you asked me that question. I couldn't quite answer it. That was about 2 months ago. Maybe you could respond to the answer that they give on artificial intelligence and the use of it in research for dementia and Alzheimer's. Okay, that's the question.
Well, I can provide a perspective around dementia care research. So I know that there is a lot of AI work happening in dementia intervention, prevention kind of research, using big data sets. But my work is mainly in dementia care. So, for example, we have huge data sets about the care of people with dementia from long-term care facilities, where we collect a lot of data day by day about those residents. And so we have a project where we have a student here who is looking at the quality of care in long-term care facilities and looking to see which markers are best markers of quality of care. And so that's using artificial intelligence and machine learning. The ambient study that I told you about, that's like 99% AI. So again, it's about generating big data sets so that we can actually really dig down to understand the sort of fundamental predictors of different events in people, as well as the STIX project. So increasingly, there are these huge data sets being generated from all the different technologies that we're using, technologies in long-term care, technologies in clinical care. And so a lot of these projects are using AI to help process that large amount of data and develop new clinical insights from that information.
I think we have an expert in the house. Alex is there, so let Alex provide his vision.
Well, thanks. So Alex Milos, I'm a senior scientist here at Toronto Rehab, and I lead the AI and robotics team. So exactly what Andrea is saying is correct. AI is being used in this field from, right from analyzing large data sets from, sources from imaging to biological data, et cetera, to look for patterns in that data and to understand what's happening to it, to kind of on the other spectrum that, we really tend to focus here at Toronto Rehab. And I think that's what makes Toronto Rehab a bit unique around the world when it comes to AI research in dementia. When you look at the AI centers out there, whether it's Vector Institute here or AI research happening at UHN or at the university, they tend to focus on traditional healthcare settings, right? So taking data from electronic health records, from, again, these kind of more classical sources where you have very large quantities of data, very nice data sets that allows you to build these models. And, as AI researchers, that's easy data to work with. That's easy AI, right? Because the data is clean, it's large, there's a good amount of data to do something with it. What we deal with, though, are data sets are being collected in the homes and the communities from these individuals, which is very sparse, very messy data, very difficult to label and understand what's going on with respect to the behaviors of these individuals. But that's really where care is being provided, is in the home and community. And so those are the AI problems that we tend to focus on more here, which tend to be far more challenging, but at the end of the day are probably going to have a larger impact, especially on the care and the management of the disease, as opposed to traditional what you're seeing. And so that's really what we're focusing on here is, how is AI be used to, not only provide an intervention, but understand if that intervention works and to modify it on the fly, right, in real time, in order to give the best care possible to people.
Thanks, Alex. Maybe I'll just ask a follow-up of Keith, because as we've seen, the developments in AI and around technology, around computational power, have really reached a threshold where it's opening up enormous possibilities of this technology. And what we're seeing in many areas of health now is actually the data is limiting. The data sets to learn from, to apply to, and so on. And you know, Toronto is a great global hub in artificial intelligence. Much of the early work was done here in Toronto, and there's a great opportunity here. And in other areas of health, we're looking to break down barriers to increase the ability to capture data, to share data, and to amalgamate data and data sets across institutes and across boundaries. So I guess my question for you, especially with the association, is, you know, where do you see the barriers to kind of unlocking the data, to sharing data across institutions so that we can apply some of these new technologies to learn at scale?
Sure, thanks. Great questions. First, I'll start with Walter asked me to respond to sort of what I heard here, and I think I'll start by saying, it's nice to see Alex again. Alex and I go back about 6 years from when I first started working at the Alzheimer's Association. We were happy to be able to provide some funding in 2008, I believe, through an Everyday Technology and Alzheimer's Care grant to some of your work, and it's wonderful to see how that's built over time, and to see what you're doing here with your colleagues and Andrea is amazing. From my perspective, we've seen more uptake of artificial intelligence and big data probably in the pharmaceutical companies, and less so really in academic medical centers, universities, and research institutes. So it's very heartening, from my perspective, to see this uptake now, happening in the development of approaches to deal with not only, as you mentioned, the classical kinds of data, but the new kinds of data that are developing. Now we're all walking around with many sensors in our pockets, right? We all have these wonderful computers that we call cell phones that are gathering all kinds of data on us for Google and for Amazon, right? But also that we can unlock as a medical research community to do work with as well, sort of passively and unobtrusively collected data that probably provide lots of hints from things like gait analysis, but also speech patterns. We all have the accelerometers on our wrists now as well, so lots of data. You make a wonderful point about unlocking this data. How do we get it to be shared? And that's something where we've had some luck at the Alzheimer's Association. It sometimes takes a sort of an honest broker, right? So I mentioned the GAIN tool that we have. I mentioned that earlier, which has data from 500,000 people on it, very well characterized people, genetics, medical records, imaging, cognitive testing, et cetera. And a lot of that actually has come from pharmaceutical companies, which traditionally have not wanted to share their data very much for good reason. But if you have an honest broker that can come in and say, we respect CDAs, for example, we're not going to do anything that's going to give one company a competitive advantage over another company, et cetera. People are willing to work with us, and I just see that exploding in the future as well.
Hi, I had a question for Dr. Fargo. We're wondering, how do you ensure that research and innovation in the U.S. is shared globally, and particularly in Canada? Also, just because you were talking about honest brokers, wondering if you've looked at blockchain technologies. There's a lot of even high school students, and they're really into that space of solving problems, et cetera, and how would you engage younger people to look at Alzheimer's, what's happening with their grandparents or that peer group, and get them interested in, other than the hot topics AI, how do we engage them in the conversation and engagement as well?
Yeah, great question. I think we have 3 minutes left. I think I'll start. So I won't say very much about the questions, except just to say that we've been very encouraged by the fact that young people do respond. One of the approaches that we've taken is to have close relationships with celebrities, because everybody responds to celebrities. So, for example, Seth Rogen has worked with us fairly closely and was able to get a lot of young students on college campuses across the country involved in the fight. So those kinds of approaches have been very valuable for us.
Okay, I think we're out of time, and I want to thank all of our speakers today. And as you've seen, we have an incredible group of people working with using their talents to really create a new treatment for Alzheimer's. And this is really critically important, as I think you got the hint from our last hour and a half. So I would like to thank again Walter and Maria and the Schroeder family for their generous donation, and I really would like to invite all of you to join us as we celebrate that contribution. Just outside of the auditorium, a number of staff of the foundation will lead us down for the next ceremony. So thank you very much, and I'd like to thank our speakers. Please join me in thanking our speakers again.